My name's Nick. Today we're going to be positioning for this cool series of x-rays. We'll be doing a PA, we'll be doing a lateral, and then we will also be doing the AP axial or Townes projection. All of these projections will be done with a 10 by 12 cassette, with the PA and the AP axial Townes being done in portrait, and the lateral will be putting the cassette in landscape. All right, we'll go out and get my patient. All right, Christina McCarty. See your wristband. All right, we'll get you in the room. All right, if you tell me your name and your date of birth.
Christina McCarty, 10/27/93.
All right, and we're doing some skull X-rays. So what's been going on? What happened?
My head's just been hurting a lot.
Okay, how long has it been going on?
About a week now.
Okay, all right, sounds good. And any chance you could be pregnant?
No.
When's your last menstrual cycle?
4/16/20.
Okay, all right. So what we'll do for these, we'll have you take your glasses off and your earrings off for this method, and you're not wearing a necklace or anything like that?
Nope.
All right. So I will get everything. So we'll be shielding the patient from the waist down for all of these projections. So no extra radiation to the gonadal area. So we will start with the patient facing the wall. We'll start with the PA, the patient facing the wall.
Sorry.
All right, so for this, we'll have the patient, routinely this will be done with the patient supine. For demonstration purposes, I've elected to do them with them erect. So you'll have the patient on the table, and their forehead and their nose will be touching the table to put the OML perpendicular to the IR. This will be done at 40 SID, and there will be no angle on the CR. We have the shielding from the waist down. We'll have a left marker here to the side, on the left side, and I will be collimated all the way around top 4, light on all 3 sides, and then to include the base of the skull. After we have obtained that, we will instruct the patient to not move, stay still, and take a deep breath. Step away, and then confirm that the patient is still. The KVP and the MAS, if these all that PA will be shot at, will be 85 and 12. And we'll instruct the patient to take a deep breath in and hold it and expose. And you can breathe. And then for this next method, we'll be instructing the patient, this will be the AP Townes. We'll get them to turn around and face the tube. All right, so we'll have them to kind of bring their chin down just a little bit, so they can place the OML perpendicular to the IR again. Like I said, routinely this will be done with the patient supine, but the CR will be coming as long as we're able to get the OML perpendicular to the IR. We would do a 30-degree angle, going 2.5, entering 2.5 inches above the glabella. Oh, and I forgot to mention on the PA with the perpendicular central ray, it would be entering at the top of the skull, but exiting at the glabella. So we would have it at a 30-degree angle, coming in for the axial view. Again, done at 40, shielding from the waist down. Now, since the patient is AP, we would have the marker to the right, mark on the right side, light on either side. Again, we're doing this at 10 by 12. The IR is in portrait mode, and we'll make sure that the light is collimated on all 3 sides, and then on the bottom, make sure the base of the skull is included. We'll instruct the patient to stay still. Do not move. Again, the KVP is at 85 and the MAS is at 12. All right, we'll take a deep breath in and blow it out and hold it out and expose. All right, you can breathe. And then for this next projection, we'll be doing the lateral view. we will be turning the cassette from portrait to landscape, and we will be turning the patient to a lateral position. So I'll have the patient turn and face me. This is a right lateral. So have him just like this. All right. Let's see, and then the KVP and the MAS for this will be done slightly different. The KVP will still be at about 85, but the lateral will be reduced to about 6. The IR cassette is turned portrait, so we'll have the patient turn kind of oblique, more or less, kind of like an RAO. So I have the patient oblique and then have them turn and face me. We can use a wedge here if needed to just face the patient truly lateral. The skull truly lateral. Have them as close to the table as possible, still keeping them lateral. Have them facing straight on, confirm they're true lateral, shielded from the waist down. And now we would be doing the right lateral. So we have a marker up here marking the right, light at top, at the front, at the back, and then at the bottom to include the base of the skull. And then again, the KVP and the MAS is 85 and 6. And then with the positioning point for the CR will be about 2 inches above the EAM, so roughly about right here, and then collimate all the way around. All right, same thing, we have the patient take a deep breath in, breathe out, hold it out, and expose. And we would instruct the patient to breathe, and now we are finished with our exam. You can put your glasses and your earrings back on. We're all finished.